Welcome back. If you notice flushing on your face or persistent redness, bumps, or even visible blood vessels, chances are you have rosacea. It is a very common skin problem.
Yes, it affects more than 14 million people, and it can be mild or severe. It can even affect your eyes. Molly and I both have rosacea. Dr. Deborah Manjoney is the owner and founder of the Wisconsin Vein Center and Medi Spa, and she's here because April is Rosacea Awareness Month. Good to see you, Doctor.
Thank you.
Good morning.
Yeah, I know rosacea is something you help people with all the time. You help Molly and I. I just had a treatment yesterday.
Right.
What is April Rosacea Awareness Month?
Well,
Why is it
a lot of
important?
people don't understand that there are many people who just flush, you know, or with excitement or with embarrassment, they really flush and it takes a while to go away. That's an early form of rosacea, and it is something we can help.
Oh.
Because there's vascularity that we can help to close off with certain light treatments that we offer.
Wow, and you can see the difference here. So those are some signs of rosacea, those sort of red bumps.
That's right.
Okay, that flushing.
So there's a huge degree of rosacea. It can be just the flushing. It can be pink cheeks. It can be your nose getting red after you've drunk a glass of wine. There are a huge variety and levels of rosacea. But even the ones with the bumps, the pustules on the face, adult acne, you know, that people say, oh, is this just acne? No, frequently it's rosacea. You know, rosacea usually strikes between age 30 and 50. That's when it becomes apparent. And so, you know, it's something that we can help to diagnose and to treat. And there are loads of different kinds of treatments and ways to modify your lifestyle to reduce the rosacea severity.
So let's go through some of the contributing factors. You've mentioned a few, but there's others as well as environmental factors.
Right, the environmental factors, meaning weather, can play a huge role. The heat during the summertime can make things worse. Wind, cold wind, you know, any extremes of temperature can bring out the redness. Those are things, and certainly then things that you might expose yourself to when you eat. As I mentioned, wine, spicy foods. There are wheat. In some people can do it.
Is there a genetic component?
There can be, indeed. And usually it's a more fair-skinned person, but it can affect anybody. Even people with African-American backgrounds. You know, we see people who are what we call Fitzpatrick level 5 who still have rosacea.
Interesting, because you think about it with seeing the redness more in lighter skin.
Correct.
So maybe it's just more apparent in some of that. What are some other risk factors? You know, you said a lot of this is smoking, family history.
Yes,
some of those, do they
things
play in?
It can. It certainly can. And everybody's different, and everybody has to recognize their own triggers. So, you know, one good thing, of course, is to try to stop smoking. We say that for everything.
Yep.
You know, so try to stop smoking if you're a smoker and you happen to have it. And then the other things are just starting to recognize what may make it worse. And then use non-sensitizing cleansers. Don't be doing something harsh thinking you're going to clear up your acne.
Yes.
You know, what you really need is to not make your skin so sensitive, because rosacea skin is very sensitive.
And you can irritate it probably
very
easily.
easily.
What about cosmetics and things like that? Can they cause it?
No, they can't cause it, but things can make it worse. Always. But you know, they can make it worse. You have to be careful of which kind of cosmetics you use. Again, things that don't have a lot of chemicals in them. Sunscreens even, probably using a mineral sunscreen, way better than using a chemical sunscreen, because you just don't know what's going to make it worse.
That's one of the cool things I always find, like in your lobby area where you've got all your products, you have everything from, you know, like the highest level Medi Spa stuff to real natural stuff that are botanicals.
True, and the Epion's line is the line that I will always promote for sensitive skin. You know, and they have a variety of different products, both cleansers, toners, other moisturizers that are pure botanicals and have been tested enormously and have been found to be not sensitizing.
Yeah.
Let's talk about treatments then, how you can sort of keep it at bay, because you can't cure it,
No,
right?
you can't really cure it.
You can't make it absolutely go away.
Right, but you can use light treatments, intense pulse light. And we love using our advanced fluorescent technology just because it is stronger, and we can get to an end point where you have a much better improvement in your skin after probably 3 to 4 treatments, whereas using another type of intense pulse light may take many more treatments to get there.
That's the one both you and I have done. And so that's AFT.
Right, AFT.
Microneedling with RF can also help?
Anything with an ability to coagulate little vessels can help with that redness in the skin.
So is it really a vascular issue at the heart of it?
Part of it is.
Part
of it is. Part of it is inflammatory.
Got it, which makes total sense.
Can people prevent it from ever starting?
I don't think so. But, you know, when you have a family history, you might want to just be aware and kind of monitor what you're doing to see if you're getting a little flushed, because it doesn't always progress. It doesn't get worse and worse for every person. Sometimes it's just a matter of being a little bit pink in the cheeks, and maybe you like that.
Yeah.
You know, I don't like the bumps that come with it, though.
Right, exactly.
Well, that's one of the things, because I've used salicylic acid before thinking it was acne. It didn't work. It irritated it. But there are some medications.
Yeah, there are some
things.
antibiotics, topical things, as well as things you can take by mouth that will help reduce rosacea in many people.
Especially if maybe you're having a flare-up.
Right.
'Cause some people are used to, because I've noticed like there's an ebb and flow, and it's
Yes.
probably I'm not paying attention to some of the risk factors, but you can kind of stay on top of it.
Yes.
Maybe if you have a flare-up, the medications when
That's
you maybe
right.
want to take it.
And again, a lot of it is whatever you're using may sensitize your skin, so be careful of the products you're putting on your skin.
Yeah, great to get a consultation
Yeah,
about it.
the big thing is she can help you with it. So if you join the Wisconsin Vein Center in MediSpa on Wednesday, May 14th, they're going to have a special open house and grand opening of their MVP program. So all they ask is that you RSVP so they know you're coming. To do that, just call them. It's 262-746-9088. To learn more about all their services and products they offer, just visit their website, wimedispa.com.